Did you know that the number of prostheses implanted increases every year? Implanted prostheses present a risk of infection between 0.5 and 2%. Although it could seem a low percentage, a large number of patients are affected above all if we take into account the high number of prostheses that are implanted each year. For instance, in Europe, 1,200,000 hip prostheses were implanted in 2018. It has been estimated that in 2025, the number of prostheses will increase to 1,700,000. This means that 24,000 patients will be affected by infection with a total health cost of €1,700 million. When a prosthesis infection is detected, the treatment consists of a systemic administration of antibiotics, which usually involves long hospital stays. In most cases, a new surgical intervention is needed, leading often to a full prosthesis replacement. In the worst case scenario, the affected limb has to be amputated, and in 7% of infection cases, the patient dies. When certain microorganisms reach the implant surface, they adhere, multiply, and infect the bone. These infection-provoking microorganisms are the bacteria, and the difficulty to eliminate these microorganisms is mainly due to the fact that they can easily evade the antibiotics treatment. A bacteria defense mechanism is the formation of a protective film called biofilm. This biofilm is similar to a fortress which withstands the attacks from the pharmaceutical drugs, allowing the bacteria to become more resistant, form colonies, and improve the thickness and resistance of the protective film. This structure is an outstanding defense mechanism for bacteria, blocking the penetration of antibiotics just like a raincoat stops the water from passing through. Prior to biofilm formation, and due to the mistaken or excessive use of antibiotics, the bacteria can mutate and become even more resistant. This is a growing problem nowadays. If antibiotics are no longer valid, we cannot treat infection. In this scenario, the research carried out by Professor María Vallet-Regí faces two distinct challenges: to prevent the infection, which means to avoid the arrival of bacteria, and to kill the bacteria, even when the biofilm is already formed. Her Smart Biomaterials research group is a multidisciplinary team of chemists, engineers, biologists and pharmacists who work closely with clinicians with expertise in infection. When dealing with preventative strategies, Professor María Vallet-Regí research group are able to modify the surface of prosthesis with the aim to block the bacterial adhesion to it and thus avoid the biofilm formation. In this sense, what they do is chemically treat the surfaces of the implants so that the outer shell holds positive and negative charges that tend to absorb water and repel bacteria. Infection can also be prevented by designing the implant surface with a topology similar to that of a lotus flower or insect wings, for instance, which is nature's way to avoid bacteria adhesion. If bacterial infection is already present, the second strategy must be implemented to destroy the biofilm so that the antibiotics can penetrate and kill bacteria, eliminating the infection. Professor María Vallet-Regí proposes the use of mesoporous silica nanoparticles to battle infection. Mesoporous silica nanoparticles are extremely small, about 800 times smaller than the thickness of a single hair, and they have plenty of pores, around 1,400 pores per particle. These pores are about 2 or 3 nanometers in diameter and about 100 nanometers in length, so they can hold many antibiotic molecules, as each antibiotic molecule measures about 1 nanometer or less. The group of Professor María Vallet-Regí is focused on loading the pores of these nanoparticles with pharmaceutical drugs, while modifying the external surface of the nanoparticles with guiding molecules, able to drive them towards the infected area with total specificity. The drugs are loaded inside the pores. Its surface can be modified by anchoring molecules able to direct them to the bacteria colony of the biofilm where they act. In the bloodstream, they can direct them to the objective, the infected bone. Once there, if the biofilm is not yet formed, the destruction strategy acts on the bacteria themselves, penetrating them. To achieve this, small amine molecules or macromolecules such as dendrimers and catatonic polypeptides can be used. In this way, the particles are internalized inside the bacteria and kill them. If the biofilm is already formed, a destruction mechanism must be put in place. To destroy the biofilm, antibiotics are incorporated into the pores of the mesoporous silica nanoparticles and lectins on their surface. Lectins are molecules that specifically recognize the mucopolysaccharides present in the biofilm, and when the nanoparticles reach it, they release the antibiotic, eliminating the infection. In addition, mesoporous silica nanoparticles can house different drugs or antibiotic cocktails in their mesopores that act synergistically at the focus of the infection, resulting in a combination therapy. To summarize, we can prevent, break, and/or eliminate the infection. To prevent infections, we are using materials with modified surfaces to inhibit bacterial adhesion and biofilm formation. In order to heal the infection, we can introduce the nanoparticles into the bloodstream, once loaded with antibiotics and anchored molecules in their surface, which can direct them to the objective, the infected bone. In this way, mesoporous silica nanoparticles penetrate and destroy the biofilm and/or bacteria. With all these possibilities, a personalised treatment is sought, where a multidisciplinary team of experts will be able to design a customised therapy for each patient.